Hello, hello, hello. Welcome to Life Discussions with Dr. Jefferson. I am your host, Dr. Jefferson, and this is a channel where we have conversations about accountability around the topics that affect the Black and Brown community. I'm very passionate about what I do, and we have a variety of conversations over here. Typically, you guys send me a topic suggestion, and I bounce right into it. Today, we're going to have a conversation around the clinical community and accountability. And of course, I'm a clinician. And if you didn't know because you didn't see this channel before, then of course now you know. So, mental health is a very difficult field to be in. I think for obvious reasons, right? Like sometimes, you know, people in general have a tendency to group you into a generalized assumption about people who do the same thing you do. We do it every day when we talk about police officers and what it means for them to put their uniforms on and go out into the community and, either represent or misrepresent what it is to be a police officer. There are several things around that. I thought today I'd come to you guys and I'd talk a little bit to some of the talking points I've already covered in Kevin Samuel's um, I don't know what you want to call it, but his perception that Black female clinicians are inadequate. So I have had the chance to look at some of the content and some of the comments of Dr. Boyce Watkins. I've had a chance to review in thorough, by the way, Umar Johnson, who goes by Dr. Umar Johnson, and several other aliases and things like that. And there are things that I say are probably some areas that have, we should all be concerned about when we look at some of these people. When you think about the charge that comes with being a clinician, the charge that comes with being a person who is a medical provider at all, it comes with a large responsibility. And for me, oftentimes I sit back and I ask some very difficult questions of people because sometimes we make the overarching assumption that by way of a person being a clinician or a mental health provider or other type of health provider for other people, um, there is this seemingly huge or large ego that comes with it. But on the contrary, it comes with a lot of insecurities for the most part. Every person that I've ever trained as a clinician who was just unifaceted, so just one faceted, those people have personal doubts about the field that they're about to go into, what it means for them to be responsible for other people and other people's lives and how their lives pan out as a result of them seeing them. There are a lot of things around that. Even I myself, and I'm pretty seasoned, and I come from one, field of medicine to moving to another one. And I feel like you still have to be very curious in your journey to becoming because we're responsible for helping other people become. So that's very complex in and of itself. But when I look at, and I really take a good objective look at the various small spaces that are held by clinicians of color exclusively, and then I look at the larger spaces where all clinicians have a tendency to gravitate and be a part of these organizations. There are some things that I see that definitely raise concerns for me. If I were a person who were being objective and not a person being subjective to the fact that, okay, these are my fellow clinicians and we are of color and we need to defend what it means to be a Black clinician. As a result, I do have to be 100% honest and, ask the difficult questions, if you will, about the experience. So, my question to you guys is, Have you ever seen a therapist before? Have you ever gone through a therapeutic journey? And do you know what that looks like? And you don't have to disclose to me who your therapist was, who your therapist is, the frequency in which you get help, um, or any of that. Mental health is a very expansive field of practice. And oftentimes people get them misconstrued. And I'm a person who's always out there to make things very clear to people so they understand that we're all different. We're not the same. None of us are one and the same. The training is very extensive, and some of us house all the trainings, but some of us don't. And some of us go into specialty training so that we can understand some of the framework underneath what guides and shapes a clinician's specialty that we don't have. However, we're not all created equally. Neither is the efficacy of one clinician over the other, because some of us don't do the same thing. But I think it's an important question to ask when we're kind of evaluating the validity of some of the claims that Kevin Samuels has brought up. So I think that a lot of people know, especially you guys, if you guys have been watching me for a while, you know that I definitely am not a fan of KS. Okay. Think he's an asshole personally. But the thing is, with me being the person that I am, and I'm so far from not being healed. I'm a person who believes in looking at the world for what it is and evaluating situations for what they are. And I just don't cut any corners. And so that's the reason that I have this accountability channel, because I'm the person that can have conversations that really don't make me feel comfortable, but I can have them and see the validity in all sides of an argument. Okay? That's what makes this channel different than other channels. So if you come on here and I've done a review about you, and that review, according to you, after looking at it, is received as a negative review, I'm a person that will sit you down and we can have a conversation about what your thoughts are around what my review yielded, right? Because I want to know the answers to the questions that I ask. And the only way I can get those answers is for you to answer them directly. So let's talk about some of the things that Kevin Samuels said during that interview. During the interview with this young lady, he said several times, "You as a therapist should know these things." And then he went on to say, I'm starting to think that this is a problem. This is a problem because, like, I just had a psychiatrist on here, a female psychiatrist on here, and the delusion is real. The cognitive dissonance is real. I'm not even going to talk about cognitive dissonance in the way that he misused it. But I think what he was trying to say is that the incongruence in how you women present to me is real, and it's real amongst people who are responsible for the mental health care of other people. So it raises some concerns, some very valid concerns. I'm not going to move away from that because, to me, sitting there and listening to this young lady, I feel compelled to explain to people what should already be evident. Even though we're clinical staff, even though we're clinicians, we're still human. And in that experience of being human, we're still evolving. And the wonderful thing about psychotherapy is that it's an evolutionary cycle that can only happen by way of you having an objective lens to guide you through the process. So if you're the person who's in the dance of your life, there is no way for you to keep yourself calibrated. Okay. And so that's why I stress the importance of people having a therapist, whether it's a clinician that I'm training or not. You need to have somebody that's on the outside looking in, that has no dog in the fight, if you will, that can be honest with you. I say that all the time. Oftentimes, and way too often, we as clinicians think that, okay, well, you know what, I got all the answers, because the reality is we don't. None of us have the answers. Even when our clients heal, even when you guys step out and you've done a complete 180 and your life has transitioned into something wonderful, more fulfilling, it's not us. It's really you. We might be there to guide you through that process, but we're not the people doing the work. And we're not the people who hold the answers. You do. So when Kevin Samuel says that this young lady, because of her situation, is inadequate in being a clinician because she has no idea what her life story yields, right? And the things that she needs to do with herself, to herself, for herself, to position herself in a different space in her life. Well, he's not a clinician, so I can't really hold him to that. I can't hold him to that higher level of thinking. I mean, he can definitely say she doesn't practice what she preaches, but the reality is there is no way that a clinician can be her own clinician. And so what happens is if she has a therapist and she's being transparent with her therapist along that walk of life should yield some level of revelation for her that also yields a transparent guide to path to change, not on the surface but on a deeper level. So when we talk about second order cybernetics, that's what it's called. Really what that means is systemic change. So you change the way that the system operates. That means internally we change the way that you perceive the world around you and how you process it, how you store it, and how you go forth and apply the way that you received your experiences with the world around you. So if this young lady is amidst her chaos, follow me now, I'm going somewhere with this. If she's in the dance of her chaos, there is no way for her to be able to see what's on the outside. You understand? So if she has a clinician that is a female or a male, regardless of what they are, they're responsible for seating her in her insight so that she can find the resources after she knows what's all there to choose from. She can find the appropriate resources to now make a change. Now, from what the young lady said over the course of that interview with Kevin Samuels, it sounds like not only did she see modeling behavior in her clinician, because she said she's working on it, but also it sounds like she had become pretty repetitive in her attempts to change her life to, get to a more desirable, the desirable component of herself. So she had started for 3 weeks. She had been working out and things like that. Now, what I noticed is that even though there is some validity to what Kevin Samuels is saying when he does mention that, okay, think about it. This is what he says, right? He says, think about it. Would you recommend another person? Would you recommend another person see a black therapist like you? And I think the young lady was, she kind of paused for a while and he had to bring the question back up. But I'm curious, before she answered her question, why it was she didn't find herself seated in exploration as to what do we think about these things realistically when we're selecting a mental health provider to go to or selecting our medical doctor to go to. So how many of you, before you selected your primary care doctor, how many of you went to their profiles and did your due diligence and said, okay, well, my doctor has 3 kids and a horse and he likes horseback riding, and because we put that stuff on our profile, we put it there. But what I will say is that as a medical doctor, I've never had a patient come in and say, hey, Dr. Jefferson, I know you love riding horses. Me too. Never had it happen. So I guess what I'm curious about is how many people actually care about the personal lives of their mental health provider or your general health practitioners. How many of you care about what our personal lives look like and that kind of stuff? Because another one of the questions that I posed in the description component, right, was what does the personal life of a clinician have to do with their efficacy? And that's the effectiveness in which they employ clinical methodology to heal you, help heal you, lead and guide you. So I'm really curious about that. And it's not that I want you guys to deflect your attentions away from the obvious issue that Kevin Samuels is pointing us directionality wise towards. But I'm just curious about that. I want to know how many of you before this conversation, before Kevin Samuels made his statement, how many of you felt like, okay, I need to properly vet my therapist personal life so that I can decide whether or not I want to go to them. And then the bigger question is, why do you think that that's important? Because here's the reality. The best clinicians are clinicians that are able to externalize not only the issues that you present with when you come in for therapy, but also externalize their own personal views. We are trained to recognize all of our biases, every single one of them, altruistically. Now, is it possible that you are seeing a clinician who did not do their due diligence? Yeah, 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 definitely. Because I'm not going to say that there have not been clinicians that barely make it past these classes and still end up in a clinical role. Okay. So let's just say that that was a particular point that this particular clinician decided to skip over. And she said, you know what? I don't feel like it's important that I recognize and I heal and I go through this process and I have to reveal layers of me before I can get to doing this job, right? It's very possible that a person that you're seeing has been in that position while they were rendering you know all of themselves to education and stuff like that. It's possible that they just say, you know what, fuck that, I'm not doing that. I don't want to heal. I don't want to go over my trauma. I don't want to go back and try and reveal these layers of me being hurt. I don't want to do any self exploration, blah blah blah. It's definitely possible. Okay. The likelihood, though, is very, very slim. You say, I always thought it was inappropriate to bring up things like that. I don't ask them personal questions. I don't ask, but if they bring it up, I try not to ask too many questions. Okay. Now, Shay, let's explore that because a lot of clinicians, and I'm going to say it depends on their epistemology because in our epistemology is what grounds the foundational principles in which we render therapy. So that I guess the organizational framework of clinical conceptualization, the way that we see the issues presenting in you and what they mean and the significance in the grand scheme of your life and things like that, right? So, as helping professionals, we are trained to recognize our biases for that reason because your clinical conceptualizations have nothing to do with your personal conceptualizations. Does that make sense? So, to give you guys a good idea, right? Personally, I I just inside of me I get sick if I have to see or interact with a sexual predator. Okay? That's the personal component of me. However, clinically, it's not that it's a different person in the room, but it's a different version of the person in the room because my clinical know-how understands that it takes personal resonance in order for people to reach a place to where they can actually effectively change, right? on a secondary, on a secondary type of surface change. Okay, so like the epistemological, framework of how I view sexual predators and things like that is very different from a clinical stance than it is from a personal stance. And in other words, I know that people can heal. As a result of me knowing this, I can definitely facilitate space for them to grow and to heal. Okay? Personally, we can't sit and have any conversations, you know, mm-mm, mm-mm, nope, none of that. Because my personal reflections, although checked at the door, right? When I get ready to render therapy, when I walk into my office, I check all my biases at the door. That's where they stay. Because what's important for me in a therapeutic context is the healing journey for my clients. And this is also something that should be important for other people if they're therapists. But you also should have a therapist to keep you balanced, calibrated, competent. So when Kevin Samuels is asking the question about whether or not these women are honest with themselves about what they want and how they're going to achieve these things, I think he negates the very important thing that's necessary to approach there. And that's an understanding that clinicians are people before they are clinicians. They're human beings. We are sisters, mothers, friends, girlfriends, wives, you name it. All of these things. And all of these things can take a toll on the personhood of a clinician. Now, I take into account the same things when I go out and I'm evaluating the content of clinicians who are putting stuff out there, okay? So, when I did my review on Dr. Umar Johnson, there were a lot of inconsistencies in his presentation that raised several red flags for me. Um, Several red flags. So I'm a marriage and family therapist. I'm not a social worker, but social workers have a thing they subscribe to, and it's called do no harm. At the core of all of us in our ethical premise, right? We are all here to help and not hinder the process. So none of us want to inflict harm, whether emotional or physical, upon the clients that we serve. And so, and of course, like as a medical doctor, the caduceus. So if we think about all of the people who are in the helping profession, including Dr. Umar Johnson, when you speak of harming someone else as a part of the work that you're doing, it raises several red flags. And it does say that maybe there is something that is wrong with us as a subgroup of clinicians. So I can't get away from the accountability conversations around this because it doesn't just end here. There are several things that I have witnessed and I've seen inside of these very, very small groups of Black clinicians where it just makes you just wonder. It really does. It makes you wonder. Like, I wonder about the stability and the overall health component of the population that they're serving. And there are several things that need to be checked. Okay. So, this particular conversation is meant for people to empower themselves with what they need to go forth and ask the difficult questions. If you guys are in the therapeutic context, even you're seeing your medical doctor, there are certain questions that we definitely have to answer for you. Some of them we don't have to because we're entitled to our privacy just like you. And okay, I guess the other part is that the personal views of a clinician, to be honest with you, should have nothing to do with the service that they're rendering for you. But I do think it's necessary for you to ask the baseline questions. Those are questions around how passionate they are about the work that they're doing, not only the work with you, but in general. this field that they decided in. One of the other questions that's really important for you guys to know is, what made you get into this field? Like, what is your end game, right? Because everybody has their vision statement. Visions sometimes aren't in alignment with what their true passions are. I feel like and I know I'm going to piss a couple of clinicians off when I say this, but when a clinician is in it and she's in it for the money or he's in it for the money, and that's the only reason that they're doing what they're doing, I think it raises several red flags. Because what happens when your money slows down? What happens when your insurance is no longer valid, right? But you still have a scheduled session. What happens when that clinician wants to take a vacation? What happens when that clinician becomes burned out? You know what I'm saying? Like, these are things ethically, a lot of things could happen. And at the end of the day, you're responsible for someone else's life. And so it's just so many levels of wrong there. Another question is, how do you handle difficult situations when it comes to, unknown territory, uncharted territory? I would want to know that the person that I'm seeing to keep me balanced definitely believes heavily in consulting with other professionals who are of a higher level of competency than them. I would want to know that they are also considering best practices, continuing their education throughout their track and their tenure as a clinician. These are things that I feel like you should definitely arm yourself with going into the therapeutic setting, especially when it's a serious issue that you're dealing with. The other component is, how long does it take you to render a diagnosis? And how important is a diagnosis to the treatment planning process? Like, ask those questions, because the things that I do notice that are incongruent when it comes to clinicians that have a lower level of competency, and the ones that have raised red flags for me just looking on the outside looking in, when you see clinicians that are like, you know what, oh, there's no need for note taking, there's no need for documentation, oh, there is no need for a diagnosis. The fuck, what are you coming to be treated for then? Hey Lisa, how are you? What are you in therapy for then? I just want you guys to think about that. So therapy, think about therapy as the prescription medicine that you would get from your primary care provider. Okay? Follow me, I'm going somewhere with this. So, let's say you walk in to your PCP and you're like, "You know what, doc? I'm suffering from a persistent headache. Like, my head has been hurting here, here, oh, right here in the back of my neck. Like, oh, it is giving me a ton of mood swings, okay? And you know what? I can't deal with the light either. The lights are on, I'm just losing it. Then I start seeing dots everywhere. Like, oh, okay. Are you also hearing voices? And you're like, no, not yet, but I feel like it's coming. Feel like it's coming, right? Follow me. And so let's say your doctor says, "Oh, okay, well, you know what? I'm just gonna prescribe you some narcotics. It'll help you sleep and it'll take away the pain. You said you were in pain, right? So let's just say the doctor wrote you a prescription for these narcotics. Okay. You go to the pharmacy and you give them the prescription, right? Upon giving them the prescription, you sit there and they're like, well, give us a little bit. You sit there and you're waiting for your medication to be ready, waiting for them to call your name. An hour later, you're asking them, what's going on with my medicine? What's wrong with you? Like, it's a lot of lights in here and my head's still hurting. So let's just say that they show you the prescription. They're like, well, let me show you this. Your doctor sent you with this prescription, right? And you're like, yeah, okay. Well, typically, when a person brings in a prescription, it's specific, so we can attain it, and it's measurable, and it's reasonable considering the condition that you are in or not in. So treatment plans are smart. Those words I just mentioned are components to it: specific, measurable, attainable, reasonable, and wonderful, timely. So there has to be a specific amount of time that you are supposed to take this medication. Okay. The doctor didn't write that. Specifics would be what type of medication is it, but also what type of condition is it that you're being diagnosed with. Okay. Because these are very important when it comes to the prescription medication component, because we need to make sure that when we measure the amount of medication that you're prescribed over the course of the time that you're supposed to be taking it, that is reasonable considering the condition. So if you have a prescription that doesn't fit, then maybe there's something going on with this practitioner. So we all have NPI numbers that tie us into the grand scheme of things for accountability. And so, if you don't have a diagnosis, if you don't have a specific plan as to how long we're supposed to be in therapy, what are these sessions supposed to look like? Like, okay, what are we supposed to be covering in these sessions again? Like, all of these things. Then, how are you possibly going to therapy? Make it make sense. You need to ask your therapist these questions. So, let's see, I'm still battling the same problems. I feel like we're going in circles. Just me talking and him ending the meeting with, I will see you at the next session. Been seeking help 6 months now. Oh, wow. So you've been seeing him for 6 months, or you were looking for a clinician for 6 months and then found him? Mm-mm. You see what I'm saying? It's it's these things. It's these things for me. Hey Jermaine, how are you? It's this for me, and that's a whole it's a whole mood. So clinicians have to be held. Oh no, ma'am. Mm-mm. I would definitely go in and ask the questions that I've given you, but also I would specifically ask, you've been seeing him for 6 months. 6 months is a whole treatment plan for a person coming in with mild issues. And I'm definitely not gonna, go as far to ask you about the issues that you went in presenting with and you're still having difficulty with now, because I don't want you to, put yourself out there. But maybe send me an email offline, and maybe, I can facilitate some space for more consistency in your treatment with your provider, or make some additional referrals. Because here's the thing: if your clinician cannot answer the questions that I just talked about, you should be asking yourself, why am I here? And trust me, the answer is not to alleviate the symptoms, because if you've been seeing somebody for a cool 6 months and you still are in the exact same space and you're still struggling with the same problems, and all we doing is talking. Psychotherapy, by definition, psycho is of the mind. Okay. Therapy means healing. Okay. So psychotherapists are people who specialize in talking you through your healing process of the issues of the mind, of your psyche. Okay. So that process looks like we have to identify not only what you came in presenting with, but also we have to be able to identify the underlying issues that are, seeding those behavioral issues or emotional instability and things like that. So that process looks complex, but we can definitely tell you about how long it's going to take us to get to the root of it because we have a plan. Treatment planning is about having a plan as to how you're going to get there. Treatment should look like you began at, X amount of sessions a week. And then, you know what? You move down to X amount of sessions a week, which is less than that. And then, that's the middle phase. And then toward the end, you're tapering off to maybe like once a month or so. But what's important is that you understand that you have to advocate for your mental health. When I hate it when I find validity in this guy's stuff. But let's go a step further. Kevin Samuels talked about women not being able to be transparent or honest with one another. Psychotherapy is about not you being honest with someone, but you helping other people become more transparent and more honest with themselves so they can position themselves in a space to where they can now heal. Okay. If we can reveal it, then we can heal it. If we can't see it and therefore it's still masked, then we can't heal it, right? Like you don't even know it's there, right? So in this day and age, I think everyone should get a mental health checkup. I totally agree. But I feel like the practitioners definitely have to be suited to adequately do the job because I think that that's the issue. When I look at the amount of chaos going on right now, and then I go back and I immerse myself in these groups where there are several black and brown clinicians. You know how sometimes you see things on social media and you're like, well, if it don't apply, then let it fly, just go right past it. You can only do that so many times when you're in a group of people that are professionals who are responsible for other people's health and wellness. I saw Umar Johnson and I was like, whoa, wait, okay, let's have a conversation. If you're supposed to be a psychologist, you're responsible for helping people to understand better how their behaviors align with particular diagnoses and how having those behaviors align with these particular diagnoses, how that part means they need a certain level of treatment in order for them to get to a greater level of functioning and mitigate those symptoms, right? No, nay, nay, nay. Umar Johnson is like, no, I'm not going to be able to psychologize some people on the street because, they got to be put to sleep for good. No. Yeah. Like, that's just not the way that you approach humanity. It's not the answer, especially as a professional. So I think this conversation of accountability calls for Black mental health providers to get themselves in check, in order, in alignment, if you will. Because there is one thing for us to separate ourselves from the whole of other practitioners who are non-black. But there are other questions when we decide that, okay, you know what, we should just experiment. Let's just see what happens when we don't keep notes. Let's just see what happens when we don't have a diagnosis. What happens is you worsen the condition, perpetuate the cycle of ill conceived behavior, undesired outcomes. You say Umar Johnson, he is the one that should be put to sleep. Man, I'm telling you, it's a lot. It's a lot, and here's the thing. After I did that review of Cynthia G, one of my followers, Anti-Africans Fingalis, I think she She follows Cynthia G. And, I had a couple of other people send me some stuff, and they claim that she is some level of a mental health practitioner. I don't know. There are a lot of qualified mental health providers out there. So it's so many different facets that we work in. It can sometimes be exhaustive. I myself wear like what, 10, 12 hats. So there are several things that stood out for me in that review. And I really don't think I need to go back over it. But the reality is this: there, human beings have a significant issue when it comes to jealousy, and envy in general. And I feel like these are some of the issues that we have to do a better job at gauging and recognizing when they are an issue for us. So, especially when you're a professional of any sort, you don't need to be providing care or oversight for anybody, and you don't have yourself balanced. Work is sometimes hard. Engaging in society is sometimes hard, but we have to learn how to allow ourselves to see ourselves for who we are. And when we don't allow ourselves to do that, we create chaos for the world around us. So we just have to do better, okay? We have to do better at accountability. We have to do better at providing adequate oversight and care for us. And, you know, Kevin Samuels talks about the fact that so many of us do not take in consideration the importance of obesity and how it plays into American women being single and unmarried, and people not wanting to marry them. I will say this: everybody has their own preference, right? Some guys like thick women, some guys like fat women, some women like fat guys, some women like thin guys, right? However, the health component is not directly in correlation with their weight. Now, we do have some particular risk factors, with extreme or chronic obesity, right? Now, if people are really overweight, not people that are just 20 to 30 pounds overweight, right? But people who are chronically obese. So we're talking about 50, 60, 70, 80, 90, 100 pounds, right? So, or more. And you're still getting bigger. I don't think that it takes a Kevin Samuels to tell you you probably should be smaller. So I'm going to give you guys a general health check-in index thing, okay? Everything typically will start with your triglycerides, so cholesterol levels being elevated. So I say the rule of thumb is this: make sure that the top of your waist, we weigh everything by your cervical areas, okay? So the top of your body does not need to be heavier than the bottom portion of your body. So waist up doesn't need to hang over the waist down view. And when it does, just know that that is a thing that could indicate, health risks for you. So, as long as you're not there in that index for the most part, and you're continuing to get your annual health screenings and things like that, and everything looks good, live your best life. Be your best version of you. Be whatever size you want to be. Have at it. Okay. So, I guess in wrapping up, what I would say is that there is definitely some issues going on with Black clinicians. And I think that Kevin Samuels definitely had a valid point when he asked that question. Personally, if I had to answer the question, because that's what it boils down to, the person that asked me to go back and do this in a more in depth way as it applies to my own personal views, right? If I had to answer the question, would I refer someone to a therapist like me, the question would be hands down, hell yeah, I would. Very well calibrated. I am extremely qualified, overqualified oftentimes. But I never take on a client that I know that I don't know for sure I can help. So he said I'm a stick man. Well, just hope that your top part doesn't become, who's that guy on that Minions movie? I can't think of his name. You know, the scientist, evil scientist guy on the Minions movie with his name, Kevin and Bob. But but yeah, I would definitely recommend myself as a clinician. But when I say I don't recommend black therapists, um I just don't, because I don't recommend that people select their therapist based off of their race or color. I recommend people select their therapist based off of efficacy and specialty and the way that their spirit personally resonates with them. Because our spirit will only move for the right energy. Does that make sense? Um, but yeah, yeah. Say yes. I love how you speak about yourself. Shine bright. Thank you. Thank you. But so those are the main things that I say you should select a therapist based off of. I think sometimes the pictures don't do enough, and so places like Psychology Today, referral sources, Monarch, those places have us out here doing videos for you guys. And I think that videos are a great way for us to be able to display our energy on camera, so you can really get a feel for what it is that you're vying into. Um, so yeah, that's all I got, you guys. Thank you so much for sitting this time out with me, and you know, allowing me to have this accountability conversation with you. It's been great, and shout out to the chat. You guys are freaking awesome. Go out and get yourself a therapist today. There are a ton of them on my page on Facebook. doclqj is what's behind the forward slash. If you guys are new viewing this content, then go ahead and subscribe, like, turn the notification bell on, and don't forget to share this content if it resonated with you, or you know someone who's looking for a therapist who needs to know some of the very important questions that they could ask to keep them tailored and balanced. So that's all I got, you guys. See you later. Bye.
Who alive can't put me in a box. I redefine any definition you got. I am the tiger, I'm making steps to the top. The flames, I rip it up, you just gotta hand me the rock. Take a seat, you cannot stand it. All I know, the flow harder than a Scotch bunny. Don't try studying me, you cannot manage. This ain't what you want, bitch, I'm a fucking phenomenon. This ain't what you want, bitch, I'm a fucking phenomenon.